Hey Hygienists, welcome back to my channel. If you're new, I'm Kalesha and I am a registered dental hygienist. And today's video is a continuation of a video I posted 2 weeks ago on how to take an FMX quick in less than 5 minutes. I'll be using those x-rays during today's video to show you all how I hard chart, how I transfer all of the dental materials and existing restorations onto the hard chart. So if you're in need of some advice, some tips, some help on how you can easily read x-rays as well as transfer them, then keep watching today's video. Before we get started, there are 3 very important things you need to know when it comes to reading x-rays and hard charting. One is going to be dental materials. You need to know what you're looking at. You need to know what a root canal looks like, what a crown, a bridge, implant, composite versus amalgams, and you also need to know surfaces of the teeth. There are 6 surfaces total: mesial, distal, lingual, facial, occlusal, and incisal. So there are 6 surfaces. You need to know all of them. Depending on where you are in the mouth, those can be used interchangeably. So we'll get into that once we start charting. And the most obvious, you want to know tooth numbers. You want to know that there are 32 teeth. You want to know which numbers coincide with which tooth. For an example, number 6 is your maxillary right canine. So you want to know all of the specifics and general stuff when it comes to the mouth, whether it be mesial, distal, maxillary, mandibular, so on and so forth. Now, as you can see, my system, I do have double monitors. So I have one up top and one on the bottom. But for those of you who don't have a double monitor and you can't really see your x-rays and your hard chart at the same time, I recommend you just get some sticky notes and write down which teeth has what on it and transfer it that way. But for me, I do have a double screen, so I'm able to easily read and transfer them right down to the hard chart. But for the sake of today's video, and I know most of you probably have one single monitor, we'll be writing them down today. All right, y'all, so here are all the x-rays. Be sure to comment below and grade me. Let me know how well or how poorly I did on the x-rays. I think I did pretty good. Okay, I think I did pretty good. So as I'm looking at these x-rays, I probably didn't choose a very great patient to do this on because there aren't a whole lot of dental materials, but at least we'll kind of cover surfaces and what a composite looks like, because she has a couple of those. So yeah, let's just get started. For those of you who may have a hard time keeping up with like surfaces when you're charting, a little tip I like to use, if you have a software like mine, it actually helps you. If you look right here in the center, there's a midline there, and there's an 8, a 9, 24, and 25, which divides the right from the left as well as the top from the bottom. We know when we're reading x-rays, although it's on the left of the screen, that's the right side of the mouth. Anything going from 8, 25 and back are the right teeth, and 9, 24 going back are the left teeth. So anything facing the 8 or 9 will be the mesial, and anything pointing away will be the distal. And I like to say mesial middle or midline, and distal away or door, like you're going away, you're going out the door. So that's just some little tips to help keep up with mesial, distal, and then again, incisal, occlusal, lingual, and facial are usually, you know, depending on where we are in the mouth, and you having your patient for a reference will help. So this is our hard chart. So as you can see, it just has a general overview of how all the teeth looks. You know, just a generic overview of how all the teeth looks. Again, we use Dentrix, which makes it super easy. This is the overall chart here where you see the green and the purple and all of the teeth numbered for you, which also makes it easier. The 8 and 9 lets you know that that's the midline, right and left. You get it? All right, cool. So over here to the right, we have procedure buttons put in, which I highly advise your office manager or even you, if you know how to go in and do this, to just put in some of the most commonly used procedures that you do at your office for an easy click through. As you can see, this one has resin, porcelain crowns, build-ups, implants, extractions, fluoride, partials, dentures, whitening, just about anything that we do in office is already here on the procedure buttons. That way we don't have to go through all of the codes over here on the very far right and click restorative and find amalgam and find crowns and things. Everything is quick access just right here. So I love using that. I love having that. And also when you're charting, you need to look up here at these where it has existing other, treatment plan, and what's completed. So we're gonna be charting existing, things that are existing. So I'm gonna hit that EX because treatment plan would be saying she needs these things done. But right now, all we're doing are reading X-rays and charting them. So that's how the hard chart looks, but let's just go back to the X-rays, go through those and write down each surface. All right, so we're just gonna start with the upper right, numbers 1 through 3. Well, for this one is 2 through 4. So we know that number 1 is missing. Number 2 looks like it has an occlusal. I'm just going to refer to the bite wing, and it kind of sort of looks like it. You can't really tell on this X-ray, but if you have the patience for reference, you can always just look in the mouth. So for right now, I'm going to chart occlusal just because I see a little something there. And then just staying on this bite wing X-ray, I see number 3 has an MO and number 4 has a DO. And then we're just going to hit next. 5 doesn't look like it has anything. And I just want to go up to the PAs of the anterior teeth. So just gonna go straight across. Doesn't look like she has any anterior fillings. Now we're over in the upper left. It does look like number 12 has a DO right here. You can just tell from the different color of the material, and if I drop down with the bite wings, you'll be able to see it a little bit better because it's angled differently. So 12 has a DO. 13 looks like it has a small little filling there, MO, so I'm gonna put MO. The reason I'm saying occlusal, that's the chewing surfaces of the teeth, okay? And that's what we use for the back teeth. But the reason I say occlusal when I'm reading X-rays, because you really can't get in between the tooth without first going through the chewing surface. So you're pretty much automatically gonna always chart occlusal unless the tooth behind it is missing, and then they can get direct access to the mesial or the distal. So for this purpose, we're gonna say MO with all of them. That just means mesial occlusal. So DO on 12, MO on 13. Moving on to number 14. Looks like there's an occlusal for sure, but it goes up a little higher. So that lets me know I have to refer to the patient, look in the mouth, and see if it's going toward the cheek side or if it's going toward the tongue side. That's where buccal or lingual comes in, and also buccal or facial is pretty much the same thing. Really depends on where you are in the mouth. Looking at usually number 14 and 15 on those teeth do have some very deep distinctive grooves in the mouth on the tongue side. So usually these are occlusal linguals up top. So I'm gonna chart an OL for that one. And then looking at number 15, also looks like there's an occlusal there, but I don't see it going up. So I'm just gonna put an occlusal. So we're gonna drop down to the lowers now. We can stay on this bite wing X-ray, no need for moving. On the lowers, you usually see a lot of buccal pits on the cheek side. You see a lot of cavities there, so usually on the lower, it's an buccal filling when it goes this deep. So I'm gonna put an OB for number 18. Remember, 17 is missing. So number 18 is an OB. Looks like this one on 19 just may be an occlusal, but it goes a little lower, so I'm also gonna occlude buccal for that. And then we're just gonna hit next. I don't see any fillings on these premolars. Just gonna go down to the PA just to make sure, and we're gonna keep going across the anteriors here, and you just hit next. I don't see any fillings on all of those. All of those look good as well. Okay, now we're going over here to the lower right. I do see number 30 here, this first mandibular molar. It has an occlusal there, so we're gonna write occlusal. I'm also gonna look at the bite wing just to see a different angle. That may be occlusal buccal. Of course, I'll have to look in the mouth to be sure, but it does look like an occlusal buccal on that one. I'm just gonna go on to the next X-ray. Let's look at the bite wing, and 31 has an occlusal. All right, so now that we have everything written, it's time to hard chart. So let's go back to the hard chart, and we're gonna start with the missing teeth. I highlight numbers 1, 16, 17, and 32. I'm gonna come over here and I'm gonna click conditions, the missing tooth button. You wanna click that, you wanna hit that check, and then they'll automatically disappear. After that, I just like to go ahead and start with the upper right. So I'm gonna go ahead and highlight numbers 2, 3, and 4. Hit existing, and right here underneath my procedure buttons has the resin. It's gonna say select surface of number 2. So this is where I'll put occlusal, hit OK, and it automatically takes me to number 3. Because again, I highlighted those in the beginning. Number 3 has a MO, so mesial occlusal, hit OK. And number 4 has a DO, distal occlusal, and hit OK. Right immediately after that's done, it'll put it here on the screen for us. It'll draw it on the surfaces that we selected for numbers 2 through 4. And then I'm gonna do the same thing throughout the whole chart. So next, I'm gonna highlight numbers 12, 13, 14, and 15. Existing is already selected, so I don't have to hit that again. And then we'll go over here, hit the resin, and boom, you see it pop up here, and it's drawn exactly how I charted it. Dropping down to the lower left, only numbers 18 and 19, and they both have an occlusal buccal, so I'm gonna hit occlusal buccal, and I'm gonna hit use for all. So then as you can see, it just pops right up down here, which we love. So if the surfaces are the same, you hit use for all as compared to OK, so you don't have to do it twice. And the last 2 are gonna be numbers 30 and 31. All right, y'all, so that's pretty much all there is to it. I know there wasn't a ton of dental materials to work with, but as long as you know your dental materials and as long as you know where everything is in your procedure codes, it's pretty much the same thing. So I hope you found this video useful. Be sure to let me know by giving this video a thumbs up. Also, comment below, let me know which system you use. Do you use Dentrix, EagleSoft? How easy or hard is it to chart for you? And what do you have trouble with the most? If you enjoy content like this, please be sure to hit the subscribe button. I'd love to have you a part of the Hygienist family. Be sure to hit that bell next to it so that you're notified every time I upload. If you didn't know, that is Monday and Friday. So be sure to turn on your post notifications so that you don't miss any. And I will see you all next week. Love you so much. Bye.